for being here. My name is Amy Cornell. For those who don't know me, I'm with the Public Health Department. Just wanted to go through a few logistical items. I'll tell you who our speakers are and spell names and give you some titles as well, so we can take care of all that right now. So first speaker actually is going to be Jolene Smith from First Five. She's the CEO of First Five. She's going to say a few words as an introduction. Correct spelling of her name is Jolene, and that's Smith is her last name. Second, we're going to have Dr. Michelle Jordan, who is an assistant medical examiner from the County Medical Examiner Coroner's Office. Correct spelling of her last name is Jorden, and first name is Michelle with 2 L's. And second, we'll have Dr. Louis Gerling, Deputy Health Officer from Santa Clara County Public Health Department. Louis, L-O-U-I-S, last name G-I-R-L-I-N-G. And then we're going to have a few words from Ms. Karma King, mother who is here to join us today to tell her personal story. The correct spelling of her name is Karma, it's K-A-R-M-A, and last name is King. And right now I'm happy to introduce the CEO of First Five, Jolene Smith. Thank you.
Thank you and good morning. I can't begin to tell you how happy we are today to launch this campaign with our partners, all of the folks that you see behind us. First Five Santa Clara County's vision is to ensure that all of our children grow healthy and strong and thrive and reach their full potential. Our strategies are place-based approaches based on science and research and evidence that say that First Five's Commission needs to invest in a particular issue to ensure that our children are strong and healthy. This Family Resource Center is one of 17 Family Resource Centers that we have throughout the community serving our children and families from neighborhoods. This one is in partnership with Catholic Charities and our Health Trust. But there are 17 that are partnering with other organizations that serve communities and are rich and invested in the neighborhoods. So this morning, we are here because there's an issue that has been brought to our attention. And again, when it's based in science and research and there's evidence that we need to act, then we come together with our commission and we act. But our partners brought the issue to us. Partners who were credible and had good research and evidence to back the issue they were bringing forward. And today that issue is about the tragic accidents that occur with unsafe sleeping habits and practices. So you will hear today firsthand testimony of experts in our community who every day work to eliminate this issue that impacts the health of our children. One of the most important things that are happening is in our community is when you look at the science and you look at the evidence and you develop really solid partnerships, you can attack an issue, if you will, and really impact long-lasting sustainable change. We couldn't do what we're doing here today in this launch without the partners in the Public Health Department, the Medical Examiner's Office, our Board of Supervisors, Dr. Marty Fincherscheid, who's our health officer for our community. Without those solid partnerships, we could not begin to do what we're doing today. So I'd like to introduce some of those experts and bring them up and have them tell you what they know, the story of this issue. Because I think the story is compelling about why we have to act as a community. So I'd like to introduce Dr. Michelle Jordan, who will start to tell you why we're doing what we're doing today.
Thank you very much for that introduction, and thank you to all of you who are here today, this morning. We have an important, urgent, and potentially life-saving message to the community, and that is regarding how to place our infants down safely to sleep. Before we explain how to put a baby down safely to sleep, I think it's important to share with you what we have learned about unsafe sleep practices here in Santa Clara County. Since 2005, nearly 1/3 of Santa Clara County infants who have died and have been examined by the medical examiner coroner office have died as a result of unsafe sleeping practices. Ladies and gentlemen, that's 41 infants. 3 infants have died this year, and still others are currently under investigation. Only 2 deaths during the same time period were caused by sudden infant death syndrome, or SIDS. Many of these babies were sharing a bed with an adult or an older child, and that adult accidentally rolled on top of the infant, suffocating the infant. In other cases, babies were unable to breathe after their nose or mouths became entrapped in soft bedding, particularly blankets or pillows that were in their sleeping environment, whether that was in an adult-sized bed or a crib. Others have died simply by being placed on an unsafe sleeping surface and becoming entrapped between pillows on a couch or between a mattress or a wall. To determine that unsafe sleeping practices were the cause of the baby's death, the county medical examiner conducts a very thorough examination, particularly a scene investigation that also includes a complete autopsy. We have taken that examination a step further to include baby doll reenactments. While working with the family, we use a baby doll to have the parents or caregivers recreate the baby's sleeping situation, which helps us determine exactly what has happened. The reenactments have been very revealing. They have led to many findings of deaths from unsafe sleeping that might otherwise have been misdiagnosed as sudden infant death syndrome, or SIDS. Santa Clara County is one of very few jurisdictions in Northern California that performs the baby doll reenactments. It is crucial for us as a community to work together to take steps to ensure that parents and all caretakers of infants are aware in preventing these accidental deaths. At this moment, I would like to introduce Dr. Gerling from the Public Health Department, who is also a pediatrician, to talk about the safe way to place a baby safely down at night.
Thank you, Dr. Jordan. So I'd like to talk with you all about how to create safe sleeping environments for babies and how parents can reduce their baby's risk of dying from unsafe sleeping practices. Safe sleeping practices actually are quite easy, and we want them to become as natural as putting your baby into a car seat whenever you go out for a drive. So first of all, babies must sleep alone. Do not let your baby share a bed or any other sleeping surface with an adult, an older child, or a large pet. Remember that the safest way for your baby to sleep is on his or her back, wholly on the back, face up. Babies who sleep face down may suffocate, and babies who sleep on their sides are not safe because they may accidentally roll onto their stomachs and suffocate. Now, the safest place for your baby to sleep is a crib or a bassinet. The crib or bassinet should be safety approved and should have a firm mattress with a well-fitted sheet. Remember that babies should never sleep on an adult bed, a sofa, an easy chair, or a pillow. Now, as a pediatrician, I've always believed in the importance of bonding and breastfeeding between babies and parents. At one time, I also believed that this bonding activity could safely extend to bed sharing between parents and infants. However, after reviewing the evidence from cases in Santa Clara County through Dr. Jordan's baby doll reenactments and reviews by the Child Death Review team on which I have served for the past 8 years, my opinion has changed. Complete reviews of this evidence show us that bonding should never involve bed sharing. That is just too dangerous. We do, of course, want to emphasize the importance of breastfeeding and bonding with your baby. So to facilitate breastfeeding and bonding, Babies should sleep in the same room with their parents whenever possible, but never in the same bed. So we advocate room sharing, but not bed sharing. After each feeding, the baby should be placed back into the crib or the bassinet before the parent and the infant go back to sleep. Finally, the crib or the bassinet should always be free of toys, soft bedding, blankets, pillows, bumper pads, stuffed animals, and so forth. All of these things create hazards for the baby. The infant's face can be accidentally covered, and the baby may be unable to breathe, or the baby may become entrapped between a bumper pad and the mattress. So now I'd like to go ahead and introduce Clara King, who's a mother who would like to share her story with us.
Good morning. Thank you for allowing me to come and share with you my story. A year ago, I went to sleep with my 3-month-old son next to me, and when I woke up, he did not wake up with me. Everything that has been shared here this morning, I learned after my son's passing. I come from a culture and a generation that co-slept. My grandmother slept with her children. My mother slept with all of my brothers and sisters and I. And I slept with my children. I didn't think anything was wrong with that until my son passed away. And there's not one determining cause that we could say is my son's cause of death. There's just several factors of his sleeping environment that could have caused his death. And we discussed those this morning. The doctors have already stated. Number one is that the babies need to be sleeping by themselves to be safe, with no blankets or pillows. I want to share with everyone my story because I feel that my son's death could have been prevented. And I hope that other parents or expecting parents will be able to hear this message and to create an infant safety checklist for themselves before they put their babies to sleep at night, so that they don't have to share in my grief. Thank you very much.
Thank you, Karma. Thank you for your courage. Thank you for the love for your child. Thank you for sharing your story with us. Because that's how you take evidence that you just heard from our experts. That's how you take real life stories of the impact of a particular issue on the health of our children. And then it's up to the leaders of the community to take action on that issue. So the campaign that our partners in First Five developed together was not just based on us in a room, on what we thought would be the messages to impact the belief system of loving parents and caregivers, because that's what we're really looking at here. A shift in a belief system that is based on wellness and safety and health of our most vulnerable children. So how do we construct a message that has impact, that shifts that belief, but not in isolation of experts or leaders, but rather from communities? So we did lots of focus groups with different populations in our community: teen parents, parents from different ethnic groups, young parents, older parents, parents from different social economic levels. And we gathered information about what a message would look like in Santa Clara County that would translate into the multiple languages that are rich in our community and really have impact. So the results of those focus groups from our community said, be short, which is hard for me, but be short, be concise, be really clear. And then launch this campaign in a huge effort in all different avenues or venues to ensure that the information gets out. That's part of why we're here today. So what you see on the sides of me, as folks flip it over, are the results of those focus groups and the new campaign ads that will be on VTA buses, in shopping malls, in community centers, in all of our family resource centers, first 5 family resource centers, in health clinics throughout our community, giving a consistent, clear message that was designed based on our community voices, but a clear, concise message about bed sharing, about sleeping out of a crib, about loose bedding, pillows and other objects, so that karma, what you experience in the passing of your child, will never be in vain. Because what you're launching here today will save lives for many, many, many years to come. How great is that for you and that courage that you've demonstrated here today? So, the ads, as you can see, highlight the safest way infants should sleep. And what we crafted out of those focus groups was a simple message, ABC. Alone, on my back, and in my crib. ABC. Alone, on my back, and in my crib. Easy to remember, life-altering, life-saving. So, these ads will be available in English, Spanish, and Vietnamese. In addition, in all of our clinics, health care outlets, in our family resource centers, everywhere we can, there will be informative postcards that will also give the basic information of what you heard from our experts today, the why of it, why we're doing this, and then the simple messages that are associated with it that I just said. We also plan widespread community public service announcements. We're developing an informative DVD that will be streamed in all pediatric settings and birthing hospitals. And probably the thing that I think is really innovative is our onesies. Evelyn, if you could just wait till bring them in front. I don't know how many of you have put your children in onesies, but I certainly use them for mine and give them as gifts all the time in every baby shower I go to. But this onesies, did you see these? These onesies have the message from the child to the parent. So it's not a campaign that's just telling folks what we believe is safe, but rather the child telling the parent. The front of it says, "Love me by putting me to sleep safely." And then on the back is, again, the ABCs. How does someone do that? How does a parent or caregiver do that? Alone, on my back, and in my crib. So as the children that are birthed in all of our hospitals through this community, they will receive one of these as a gift from this wonderful partnership, hoping that we'll intervene and save the life of a child. So this will be piloted for 6 months, and we'll see the impact as we'll evaluate how people become more informed. In fact, we can evaluate by the lives that we save. So, we hope all parents will be able to access these onesies and the children will wear them. With the mall and bus ads, information, posters and flyers, videos, radio, PSA announcements, and the onesies, we hope we do raise the awareness of the dangers infants face due to unsafe sleeping environments and practices. Okay, so as Karma's tragic story illustrates, it only takes one time. Together, as a partnership in this community, being strong and staying steadfast to the shift in the beliefs by providing good, solid information, we literally can change unsafe sleeping environments and practices into safe sleeping environments and practices, and allow our children to grow strong, healthy, and reach their full potential. All of us up here are ready to answer any questions of anyone in this room or in the community. Yes, please. Yes.
I have two questions.
Sure.
How much money is going into this? And second question is, can you talk about cultural values in other parts of the world? This is very common, and I don't know if the numbers show
So I'm
that
going to
babies die in India if they sleep with their parents as well.
thank you. Thank you for the question. It's good. I'm going to speak to the first one, and then I'm going to probably ask Dr. Jordan or Dr. Early to speak to the second question because you have the science and the research. And Avo, I'm going to ask you to please come up and talk about the in-kind contributions as well as our cash, the first fives.
Sure. The cash amount is going to be $50,000 for the 3-month campaign, and then we anticipate between another $50,000 to $100,000 in in-kind contributions. So a total of $150,000 is what we're looking at.
You said 3 months and 6 months.
3 months will be the initial campaign, and then 6 months will be we'll be passing out the onesies for 6 months.
But let me first way, because my commission is really focused on data and evaluation around impact of strategies. So we want to launch this based on the focus groups and what we generated and created here. And so the initial investment will be evaluated and brought back, because if we can demonstrate awareness, changes in awareness, if we can demonstrate impact, if we can demonstrate continued partnership and commitment of our partners here to really look at this issue, then we will go back and redo it again. Because we know that information takes time. So this is not just a one-shot deal for us. This is a commitment. But we only do it in allocations until we have evaluation data to see that what we're doing is really having impact. So we may have to make some shifts.
Okay, so I think your question had to do with deaths in other cultures or in other communities besides just Santa Clara County. Is that correct?
People all over the world sleep with their children in, whether you call it a bed or a ground mat or sleep next to each other. And so we as Americans have this idea, and I know there's numbers to prove it. You could prove either way. Look at how many people sleep together and don't kill their children. You can. So I'm not being flippant about it, but I am saying that people in other parts of the world sleep with their children, and I haven't heard of like a European death craze with infants.
Okay, so I don't want to try to address what's happening in Europe because I don't know the answer to that. But what I can say to you is that we've learned a lot actually by looking at our local deaths. I'm absolutely convinced that the unsafe sleeping practices have caused the deaths of these 41 infants that we've described. And we're not the only community in the United States that is beginning to recognize this. There are many other communities that are recognizing this. You might have heard about Baltimore's campaign, and was it the state of Kansas or Arkansas that has a campaign? And we know that this there's a groundswell actually here in this country of understanding. One sort of cross-cultural example that we do know about is among Native Americans. We know that among many Native American peoples, the common bed, the household bed, is very, very common, even if it's just a sheepskin, on the ground with the whole family and the animals and everything all together on that sheepskin. And we also know that deaths from bed sharing among infants are highest among Native Americans. If you look at all of the ethnicities in the United States, they have the highest risk of this kind of death. So if that helps you a little bit, I thought I would share that knowledge, which is very clearly documented in national literature, not in local literature because we don't have enough Native Americans in our own community to actually provide that kind of data. Do we have anything else we want to add to that, Dr. Jordan? Okay. Oh, actually, I did want to add one thing. I think it's important to remember what happened back in the early 90s. When the Back to Sleep campaign, which some of you will remember, was launched in the United States, that was launched as a result of epidemiological studies in Europe and Australia and other places where babies were routinely slept face up, as opposed to what we were doing here. Even when I was in training as a medical student and a resident, it was normal to sleep a baby face down. In fact, we were taught that was the most comfortable way for the babies to sleep. We learned from Europe that that was wrong, that we needed to turn our babies over. Now we're learning here, and we're going to share what we're learning with others about how to expand those safe sleep recommendations.
Other questions? Well, the folks that are behind me, as well as myself and other experts in the room, will be happy to stay after to answer any questions that may come up.